Hi there. If you're just joining us, my name is America Paredes, and I am MHA's Associate Vice President for Partnerships and Community Outreach. My pronouns are she, her, hers, and I am so pleased to have not only a partner but a friend of mine with me today. I'm really excited to introduce Jean-Phillipe Regis. There he is. And Philippe is the Associate Director of the All Children, All Families program at the Human Rights Campaign Foundation, where they provide technical assistance and LGBTQ inclusion resources to child welfare agencies. They also lead HRC's initiatives related to BIPOC Mental Health Month. And I am very happy to have them here with us. We are going to have a very fruitful conversation around all things mental health related, around the QT BIPOC community and the range of different issues that have come up. So, welcome, Philippe. So glad to have you here.
Hi, America. Thanks so much for having me. Thanks so much for that warm introduction. I too consider you a partner and a friend. As you mentioned, I'm Jean-Phillipe Regis. I use they, them, and he, him pronouns. I am the Associate Director of the All Children, All Families program at the Human Rights Campaign Foundation, and of course, have been partnering with you for the past 4 years or so on a lot of mental health efforts, specifically around our Black, Indigenous, and people of color communities.
Definitely. And I mean, that's the focus of our conversation today. I want to hear a little bit about what HRC has been doing around these issues, given everything that's happening with COVID, and how those communities, the QT BIPOC communities, have really been impacted disproportionately by COVID.
Yeah, thanks so much. I really appreciate you mentioning that. It's a really scary time during this pandemic, and HRC Foundation has really put a lot of effort into making sure we know as much as possible about what's going on and how it's impacting our communities. So, as you mentioned, COVID-19 has been disproportionately impacting Black, Indigenous, and people of color communities. And of course, queer and trans Black, Indigenous, people of color communities, which we'll be talking about today, QT folks. And some of the things that we found in the research that we've done. So, for example, we recently partnered with PSB Research, and we released a report called The Impact of COVID-19 on LGBTQ Communities of Color. And a number of things were found that really highlighted the disparities that you alluded to a moment ago, America. And that includes a loss of work hours, a greater likelihood of becoming unemployed, a greater likelihood of having to take unpaid leave. And then, that's translating into all sorts of, everyday challenges with balancing a financial household, including challenges paying rent and challenges paying bills. And we're, of course, you know, something that, really hits me hard and always gives me pause when I think about it is how it's disproportionately impacting our community in terms of, the death toll, unfortunately. The CDC has shown that, these disproportionate impacts are ultimately resulting in not only these disparate impacts, but also in higher numbers of death in these QT BIPOC communities. And those are some of the reasons why we really are devoted to making sure that we're understanding how it's impacting us so that we can understand exactly what to be mindful of as we move forward and try and keep ourselves and our families safe. We had another report that, dived in a little bit more specifically and looked at the economic impact of COVID-19 on Black LGBTQ people. And it found similar results as the QT BIPOC report, except some of the results were even more stark, unfortunately. We're seeing Black LGBTQ people are having to make there's a greater likelihood of them having to make adjustments to their household budgets and experiencing financial stress and losing their jobs and some of the different factors that I cited earlier. Um, and those are some of the things that we really are focused on lifting up into the narrative to make sure that folks are really understanding how these things are impacting these communities that really are already vulnerable and how this is showing up um, in their mental health. And I know, America, you and I were talking a little bit earlier about that, and you had some thoughts on how some of the research findings that I mentioned in terms of, the greater likelihood of loss of jobs and the financial stress, et cetera, can impact mental health. Did you want to go ahead and share those?
Yeah, what comes to mind when I hear you kind of speak about these issues is I think the news does a semi okay job of kind of highlighting, right, that these communities are impacted disproportionately. But when you get down to actually communicating with folks at the community level, right, at the individual level, the rates of stress and anxiety and depression, yes, they're numbers, but behind each number, there are people that are really struggling. So when you think about somebody having to, you know, really consider, do I have enough money to pay for my rent? And if I don't, what does that mean? Right? Or I need medication and I have to figure out how to manage paying for medications in addition to trying to figure out how I'm going to pay rent because I don't have enough hours. And all those things coupled together, I think, continue to exacerbate the mental health of individuals. But we don't really talk about the mental health because we're just functioning, right? And when we just work in that kind of mindset, and many of our communities do that, right, where they may be black, indigenous, or people of color, we're just on survival mode.
Yes.
So since we're already part of that process, you put all this other stuff on top of the weight that we carry, and it's overwhelming, right?
Yeah.
And then you think about the deaths of individuals that are really part of these communities, and the grief that is attached to that, and the inability to actually grieve in the way that we are used to as communities.
Yes.
All of that, I think, is so damaging to our spirit and our mental health, in that we just don't know how to kind of push past it. And we have to be able to talk about it so that people know that they're not alone with all the struggle that they're having.
I agree. I agree. And I'll just take a moment to pause and zoom out. I'm coming today to this conversation, of course, as a representative of the Human Rights Campaign Foundation, but also as someone with a lot of lived experiences with mental illness and mental health challenges. And a number of my peers and friends, have similar lived experiences. And, specifically, as you mentioned, while these statistics are things that many of us may have seen in the news, or maybe they happen to come across our research and our report and they've learned these things, there are real life experiences attached to this. So I remember at the beginning of the pandemic, sort of sitting with my friends on a video call when the realization sort of hit that this is more than likely going to impact our community in disproportionate ways, just like many other issues like this will exacerbate those conditions, right? We sort of had an understanding of that very on, and it created this really sort of deep seated anxiety and grief, sort of anticipatory grief of what we were expecting to come, whether it was in our direct families or in our communities or in, the country or the world at large. And, there's something about sort of that weight that exacerbates anything you're going through individually, right? It's like this sort of
Yeah.
collective grief that can be felt when your community on so many different levels are facing these disparities, right? Like, so for example, I come to this conversation with a number of different identities. I'm Black, I'm Haitian American, I'm first generation Haitian American, I'm queer, I'm non binary. I bring a number of these different identities, and almost all of those identities have been shown in COVID-19 to be more vulnerable to these negative health outcomes and even death,
Yeah.
and holding that weight can be really challenging, and
I
something that
feel
I
that,
want
like,
to,
when you're talking, it's like this heaviness, right? That has you just carry, and it's not something that you can anticipate,
yeah,
right? It's just something that naturally is happening because of the pandemic and the fact that we've had to isolate and really find solace in ourselves, right? Yes, we can connect online and all that. And I think those are very useful tools. But at the end of the day, it's just you, and you're trying to figure out how to manage all that. How has the pandemic impacted you and like the physical distancing and the community in itself?
Yeah, I think that's a really important issue that I really wanted to touch on because it's something I'm experiencing on a personal level at different levels. And that's largely impacted by my privilege of, being at a certain age where I live on my own and having, thankful to be at an organization where I'm able to support myself, et cetera. And I'm still feeling the impact of physical distancing and how that is exacerbating certain things. And first, I want to sort of talk about what we know about LGBTQ folks, especially LGBTQ youth who are currently in physical distancing or being forced to isolate in areas where, they're not under the best circumstances. So before the pandemic, we already knew that by and large, LGBTQs were reporting that their families make negative comments about the LGBTQ community, right? And when we drill down on that even further, so HRC Foundation has a series of LGBTQ youth reports where folks can really get a great idea of what the picture is, right? What is the landscape for the lived experiences of LGBTQ youth now? What are they facing? And this is one of the things that we uncovered, right? They're facing these negative comments about their community. And then when you look at it on a personal level, only 1 in 4 LGBTQ youth feel they can be their true selves at home. And if everyone is at home right now and they're, very much limited and some completely taken away from their sources of comfort or their sources of affirmation, then that's exacerbating these things, right? And then similar parallels to what you see with the COVID-19 pandemic, when you drill down into even more into the communities that face even more bias and discrimination, such as LGBTQ youth of color or trans and gender expansive youth, you see these disparities become even more stark, right? So you see bi plus youth are far less likely to be out about their identities. Trans and gender expansive youth are much less likely to even be referred to by their correct name and pronouns. One of the most basic things as humans that we, seek in regular interactions. And just taking a pause back to look at what does that mean, right? Okay, so we know now some of the statistics, or we know that we can go to reports like I just mentioned, that the HRC Foundation has to learn about some of these negative experiences. But what does all of that really mean, right? Well,
Mhm.
it means that unfortunately, QT BIPOC folks are largely in home situations where they're really facing a lot of stress and they're facing a lot of isolation and they're not able to authentically show up in themselves, and those things have real, negative impacts on one's mental health, right? We started talking about this yesterday, America. When we talk about QT BIPOC folks being able to be their authentic selves, it's not just a matter of, one being true to themselves, and being able to sort of, have that uh, sort of personal, uh,
Like self-worth and value. Yeah.
yes,
Yeah.
this is something that can be a lot more pervasive, where you're seeing yourself erased. You're seeing
Yeah.
that you have to erase yourself in order to just show up in the world, and not even in the world, to just show up in your home, to just open your bedroom door sometimes, right? And what does that mean, when your to your self-esteem and your self-worth and your sense of a future and whether you can see yourself being happy, how does that all show up, right? And that's something that we really want to remind LGBT youth specifically who are finding themselves in these situations of some things to really keep in mind during these times. So, one thing that I like to really sort of ground the conversation in is safety and security, right? As detrimental as some of the mental, as detrimental as some of the things I just cited can be to your mental health, the erasure, the invalidation, not being affirmed. Safety and security are paramount in order to see yourself sustained to a point where you can have, an authentic life, right? Keeping
Yeah,
yourself safe is
definitely.
one of the most basic human needs, right? So keeping yourself safe is really something that unfortunately we really have to keep top of mind right now. We have to be sort of hyper vigilant in a way, even in our own homes. And I think it's important that we recognize the stress that that can bring and the heaviness that that can bring, and find ways to tackle that, right?
To come
So
together and to be able to kind of sustain yourself, right? Because that's what you're kind of mentioning. One of the things that comes to mind when you're kind of talking about this in the safe space is that too often you don't recognize your privilege to be able to be in a space where you may have your own bedroom, you may have a door that you can close, right? And those small, very small, but huge kind of aspects of our lives have to be considered when we propose ways in which individuals can help themselves.
yeah,
Um, I know one of the things that we talked about is really finding community, right? Where
mhm,
you may not have an opportunity to have affirming relationships in your most immediate circle, right? Whether that's your family or not, but you find your chosen family, right?
yeah.
And I think that's important. And tell us a little bit about your experience in this period and what you have found to be most helpful for your mental health.
Yeah, you know, I'm I think it's important to not only bring in, some of the statistics and, information that the HRC Foundation has, but also to sort of shift to this sort of personal lens and share a little bit about how all of this shows up, right? And for me personally, knowing about all of these disparities, related to the pandemic, and knowing about the hyper visibility of racial violence and anti-trans violence, and how, we're seeing those numbers get higher and higher each year. For me personally, it's created a lot of challenges with my happiness, my hope, my energy level, my productivity, my ability to focus. Those have been things that have been challenged now, in a way that I haven't really experienced before. I've also found that different symptoms of, different mental illnesses that I live with have worsened, or I've
Hmm.
even experienced new symptoms that I had never experienced before. And, having to figure out what that means, right? And seeing how all of this is literally showing up, you know, in my mental health, right? It's showing up in worsening of things, in new situations. And it really, as I was sort of mentioning earlier, it's creating this hyper vigilance about my safety, where, I feel like I'm sort of stuck in this perpetual cycle of trying to manage my health related to the COVID-19 pandemic, and knowing, the potential challenges I can face if I have to interact with systems, right? Knowing how that interacts with my sexual orientation, my gender identity expression, my race, my ethnicity. Knowing about all that, it really forces me to try and find ways to um, really keep myself safe, and that's when I even see my privilege sometimes challenged, right? I have my own home, for example, like you said, which is a huge privilege, where I can potentially, authentically express my gender, for example, behind locked doors and feel safe. But what I found is, even when I go down to get the mail or go down to pick up food, you
Hmm.
know, all of a sudden my safety becomes challenged. If I go to walk my dog, all of a sudden my safety becomes challenged. And I literally hear comments, I hear slurs, I see the looks, I can feel my safety being threatened, and that I find that, you know, when I'm hyper vigilant about my safety, it sort of puts a cap on really any of my other higher needs or desires as a human, right? It
Right.
almost
It sounds
becomes
very layered in what you're describing, right? Where when we're thinking a lot of times where safety is physical safety, it's not so much just physical safety, but emotional safety, right? Because you have to protect yourself from all the things that you are hearing, because that does impact you. And it also what resonates with from what you said is when you're trying to manage all of these aspects of your well-being, right? When you think about it very broadly, um, you have to come to terms to figure out what's happening with me now that is new, like you said, or what has worked in the past to help me move through this. Can you
yes.
talk a little bit about some of the things that you've done, or maybe that you wish you knew before you kind of ventured into seeking mental health support?
Yeah, I'd love to chat about that because I think it's really important at a time when all of this is going on and we know, many folks in, the communities that we serve are potentially really um, seeking out therapy, maybe for the first time or restarting therapy for the first time in a while. So I think this is a good opportunity to sort of share some of my experiences. So for me, I've been on a journey really as I've at the beginning of the pandemic when I noticed, the worsening of some symptoms and some new ones, it became really important to me to get back in consistent therapy because at that point I was out of therapy.
Hmm.
Um, and there are a number of different things I did. I tried using search engines, on a number of different websites, including your own. I used my insurance. Thankfully, that's a privilege that I have that I was able to look through my insurance and get some recommendations for them. And then I also asked friends. Um, you know, I thankfully, am blessed to have, a number of folks in my community who trust me and feel safe enough to share with me that they're in therapy as well. And, that can be a really great place to get some recommendations and leads. So ultimately, I saw a number of different therapists. A number of them were not great fits, to say the least. Had some pretty challenging experiences that I had to push through and just sort of keep trying to find my fit
Hmm.
because what I found is that, you know, you really have to pay attention to what's going on in terms of the consistency and the pervasiveness of things that you're feeling, and keep in mind how that can impact how urgently you should be seeking out
Yeah,
certain,
definitely.
assistance, and I knew that with the pandemic and everything going on, um, and all of the racial violence, all of the anti-trans violence, I understood that I was experiencing these things to a degree that I had to keep going and push past that. Um, Ultimately, the therapist that ended up being a good fit for me was referred to by a friend. So that turned out to be the way that I was able to find help. And, therapy really helps me in a number of ways. I think it can be sometimes a little mythical the way we talk about therapy, right? It's like we
Yeah.
often focus on trying to get people to look and, get people to even consider it, but we rarely sort of talk about what happens in the room, right? And what I find has been really helpful is being able to talk about some of the challenges I'm experiencing and discuss how it's showing up at work, in my life, in my relationships, and learn coping mechanisms that promote wellness as opposed to coping mechanisms that may lead to harm down the road or lead to stagnation. um, and really developing tools. Something you mentioned earlier, America, is a lot of us in many communities, and specifically in the QT BIPOC community that I'm talking about today. We live in survival mode for so long, and part
Right.
of living in survival mode really limits the amount of tools you have, and also the tools you have that sort of have a long-term vision for your own wellness, right?
Right.
Oftentimes we're
They're
forced,
intended really for resilience instead of
exactly,
just
because
functioning.
survival by nature is short term.
Yeah.
right? You're forced to think in the moment or at most, maybe the next day, right? So that really limits, you know, it can sometimes really limit the amount of, sort of healthy tools that you have available to you to really navigate tough times like this, and then I
What
want
I
to just
Sorry,
really brief.
Philippe,
Yeah,
I was gonna add a point there. What
yeah.
I have found though in speaking with a lot of folks in the QT BIPOC community is that they have questions about what it is to go to therapy, and oftentimes we're hesitant, right, to ask these questions because we just don't feel like we have the space for it. And I know in the conversations that you and I have had, I really appreciate you sharing your personal experience around therapy, but I also want to say, therapy can seem like a daunting thing, but I know because of the work that you've done and we've done, we pulled together a resource that was very useful, to help people kind of think through what therapy should be and really allow the individual to feel empowered to go out and seek the right kind of support. Do you want to talk a little bit about that resource?
Yeah, absolutely. So I just want to really briefly share, some of the things that I wish I sort of knew at the beginning of the experience, and some of the things that I realized when restarting this experience is that, for folks, especially like LGBTQ youth who are in homes that may not be supporting, sometimes the hesitancy or a barrier to starting treatment can be worries around confidentiality or worries around needing parental approval or consent in order to start therapy or other types of treatment. And I think it's important to note that there are so many confidential sources of mental health treatment that LGBTQ youth can access um, online and other ways that can really help them, even if they feel they may not be able to get approval or consent for someone they may be living with now. And also, to really, like to the point that we're about to get to when we talk about the tool that we developed together, knowing that you can ask certain things in the beginning, right? A lot of the negative things I experienced, I think, is because I didn't ask the questions that I knew I needed to. And they ended up showing up later in ways that caused harm, So keeping in mind that asking about things, you have discretion, you have power, it's almost like you can interview the therapist or provider that you're seeking treatment from. You can talk about demographics or other things, aspects of a provider that are important to you in
Right.
order to really get the most out of treatment. And that's why I was so excited when we worked together on this tool, questions to help QT BIPOC folks find an affirming therapist. We know that there are all of these issues that we're facing that, I touched on already. We know there are barriers to care. And then, we know that even after all of that happens, there's still too many instances of QT BIPOC folks, once they get in the room, still experiencing harm by folks um, who are not culturally responsive or LGBTQ inclusive, right? So we develop these tips and sort of questions of things that you can talk through in the
Right.
beginning to really make sure that you're addressing the things that are important to you, right? So they can find it on both of our websites, on HRC and MHA's website, and sort of look through it and figure out which things are important to you that you think will improve your treatment, right? That will help make that fit, and figure out how you can ask. For me, sometimes my anxiety limits my, ability to confront folks in the moment and ask certain pointed questions. So we can, sometimes I've used these questions via email. And then other times you can ask in person or I guess via camera these days in an initial appointment. So I thought it'd be great, America, for us to just spend a really quick moment maybe modeling one of the questions and what we think clients and professionals can sort of take away from that.
Sure. I know that one of the things that we focused on with this particular resource was being able to really give folks a template that they could really use to guide their conversation. So I know one of the questions that was on there is, how would you describe your experience treating clients who share, you would insert your LGBTQ non-binary identity, whatever it is you think is relevant to your experience that you want to learn about. Philippe, what would be a great response to receive from a provider?
Yeah, I think there are some things that I'll highlight that providers should keep in mind when responding to a question like this. So let's say I asked a provider, how would you describe your experience treating clients who share my queer and non binary identity? So some things to consider would be, have I collected information and tracked information on clients that I've previously engaged with in terms of their sexual orientation, gender identity, and gender expression so that you can accurately answer that question, right? So, because if you don't have that information, you really want to avoid um, conflating numbers or different members of the community. You want to make sure that you have access to that information so you can answer confidently and be able to say, not necessarily, violating any privacy information or things like that, but just so you can speak confidently to, well, I have, a lot of experience or I have little experience, etc. You also want to make sure, as I sort of mentioned, that you're not conflating experiences, right? Oftentimes, we know sometimes the initial trainings folks receive on LGBTQ competency can sort of keep things very nebulous and conflated, and folks kind of can lose sight of the fact that LGBTQ, the acronym contains, identities related to sexual orientation, so romantic attraction, and related to gender identity and expression, so how one's internal sense of identifying their gender rather. So that means, you can't talk about the talking about the acronym at large can be challenging, and can create sort of some confusion, potentially even harm, if you're assuming the experiences, for example, of a bi person are the same as that of, for let's say a trans man. Those
Yeah.
are different experiences, those are different risks, different things they encounter, and those are things providers want to keep in mind. And if they haven't already tracked this information, that's okay. We find, in the work that we do, many orgs are sort of working to kind of really show up in this area of data collection and meet sort of the best practices around how to really collect this information in a meaningful way so that they can answer questions like this and track their services in a way that can be helpful. And, if you don't have that in line yet, it's okay to say that and mention that, while that's not in place, you're looking to implement measures like that and, perhaps pivot to what you do know. If you don't have that personal
Yeah.
experience, perhaps talk about the trainings you've received. Talk
That's an
about,
interesting point, though,
yeah,
Philippe, because I think often people, in terms of mental health providers, may be afraid of saying, I'm sorry, no, I don't have experience in this. And that's a disservice, right, to the individual that you may be working with. And on the part of the individual seeking support, it is really about finding your voice to be able to empower yourself to find the best fit. It is not going to work every single time. You have to build rapport with the individual you're working with. And that means different things for different people, right? Maybe it is finding somebody that may be gender affirming or somebody that understands what it is to be queer and Black or Latina and gay. And all of these are nuanced
yeah,
um, experiences that we have that really have to help us figure out what we need to really help us get better. um, and Philippe, from everything that you shared, um, what you really bring to the table and HRC brings to the table is a wealth of resources that are available. I know on your website, the HRC website. We also have some on our website, and I really think that we can continue to talk about these issues forever. You and I love talking about these issues because they're so relevant. But we also know that we need to make sure that we don't only talk about it, but also act on these matters in our communities and push for policy and advocacy that really help the individuals on the ground. Um, and I know we're running out of time. So Philippe, I wanted to thank you so much for spending time with us today. And I don't know if you have a like 2 seconds that you want to like say something.
Yeah, well, thanks so much for having me. It was a pleasure having this conversation. As you know, we can talk about these things forever, but I just want to encourage folks to, check out the resources that we talked about today. And, you know, for QT BIPOC folks who may be listening, just remember that, no matter the circumstances that we're facing right now and the barriers that you may face, there's a large community out there that loves and affirms you and supports you. And there are a number of folks, on the ground like America and I, who are really fighting to make sure your voices are heard and to develop resources that speak to you and can really help you in your lived experiences as you try and improve your mental health.
Thank you, Philippe. And with that, we're going to be taking a brief break and we're going to be back in a moment to talk about workplace wellness with Matt Collins. Thank you so much, Philippe.
Thanks, America and Mental Health America. I appreciate your time.